All right, gang, 4:30 on the drive home for a Thursday. Wayne, Tanya, and Brian all here.
Indeed,
We
yes,
are.
we are.
We are. And we have our guest on the phone. We're always glad and proud to have Dr. Ryan Jennings, the Chief Medical Officer of HSHS St. Anthony's Memorial Hospital, with us. Good afternoon, sir. How are you?
Oh, good afternoon, guys. I'm great. What a beautiful day.
It is nice and warm, yeah.
Yes.
We got a good rain, especially on the north side of town. We got pounded with rain earlier this afternoon. Really came
the
down.
evening's looking good. I'm just glad to get some warm weather. Maybe people's gardens will enjoy some warmth finally.
No kidding.
Exactly.
Absolutely. Well, Doc, here to talk about things related to COVID-19 coronavirus, as you've done now for several weeks with us. We appreciate you coming on. I'll tell you real quick here before we dive into this. I've had more people, Dr. Jennings, tell me how much they appreciate hearing you on the radio as a voice of reason, as a voice of professionalism, and just bringing facts, not fear, to the conversation, and how much they appreciate that. So thanks again for being with us.
Oh, truly, I appreciate that compliment. I don't deserve it, but I'll be happy to accept it. But it's part of hopefully what we're going to do is continue to be very safe and keep our community safe as we look forward to reopening.
Exactly, and hopefully that happens soon. I know a lot of people would like it to. All of us here. Today, Illinois Department of Public Health, 3,239 new cases of COVID-19, 138 additional deaths. A couple days ago, we had more than 4,000 new cases, and so that's where we are today.
We are, and again, the other piece of that element is the additional testing that you're seeing going on. So as we've touched on before, some of it's just the reality of the more you test, the more you're going to find of it.
Yeah.
But then the utilization of those limited resources around hospital beds, ventilators, those types of things, at least regionally, has remained stable and even improved in some areas. And so, I think the gradual reintroduction of life as we used to know it is exciting. But we do have to be mindful to keep an eye on those limited resources.
And so you mentioned that, Doctor, about returning to normal. Obviously, Effingham County's board yesterday voted to approve a measure from Representative Wilhauer that would reopen Illinois on a quicker timetable than that of Governor Pritzker's reopen Illinois plan. What? Just curious on your opinion on all of this.
Well, the idea, no matter how you shake it, and if you think about kind of what we did at the hospital with reopening surgery, because we're very happy to be able to get folks the treatments that they needed and that had been delayed and those types of things, and other hospitals, everybody's trying to do the same thing. Because we realize, and everybody realizes, there's a certain level of activity that needs to be going on, but you have to do that safely. And part of doing that safely, and no different than the announcement related to the county's announcement, is there's a level of individual responsibility. I mean, we've talked about several times the reason for testing, as an example, is to protect the individual or to protect others from the individual. And so regardless of what the current status is, regionally or locally as far as the law, the land, reality is you've got an individual responsibility to keep those safe that are most vulnerable. And so we need to continue to be very mindful of those vulnerable populations, the elderly population, those that are immune compromised. We still need to be very respectful of social distancing and certainly hygiene, hand hygiene, those types of things, because no matter what phase we're in, those behaviors can't go away. I mean, at some point, maybe the social distancing will diminish, but the hygiene and always being mindful that although you feel well, you do potentially pose a risk to a vulnerable population because there is the possibility of being an asymptomatic carrier. So things like the testing that we're doing before surgery is to make sure that we don't perform surgery on someone who's accidentally carrying the virus unknowingly. And that's twofold. That's because there's very good evidence that somebody who may be asymptomatic that undergoes surgery, especially with significant anesthesia, anesthesia can get extremely sick afterwards. So we're testing to protect that individual from something that's unknown to them. At the same time, we're testing to make sure that they don't expose the rest of the folks in the hospital and a vulnerable population accidentally by the fact that they're asymptomatic. And so, regardless of what goes on the political arena, the reality is we all have an individual responsibility to look out for ourselves, to make sure that we stay healthy, but also to make sure that we don't endanger someone else quite accidentally, and not to think that there's any intent whatsoever, but just completely accidentally. So got to be careful here. I think we all realize the balance that we're trying to strike between safety and then respect for the need to resume normalcy in business and the consequences that has. But at the end of the day, there are things that we can continue to do, like making sure that we are that we don't have fever when we're going into these places, that we do maintain distance, that we are doing hand hygiene. There are things that we can do to continue to protect the vulnerable population.
Very well said. And to that end, Dr. Jennings, if someone does come down with COVID-19, Illinois has talked a lot about this. Governor Pritzker did the other day. The Department of Public Health has, too, about contact tracing. And there's a lot of speculation and pushback, even locally. We've seen this on our social media pages, about Governor Pritzker's implementation of new contact tracing protocols. Some believing and even sharing on social media that it involves a medical procedure or it violates their constitutional rights. And some people seem to be confused about exactly what contact tracing means. Can you explain that a little bit?
Sure. And now this is not something new related to COVID. We've always done contact tracing for high-risk transmissible diseases. Not so much flu, just because it becomes so pandemic, or not necessarily pandemic, but becomes so epidemic every year that there's not a lot of point. But other diseases, we go back and go, okay, who were you exposed to? Try to find out where they've been. If we can identify then folks that they've been exposed to, it's work done by the public health department. And in this particular case, again, to try to go back and go, okay, was this potentially a travel-related exposure, or is this continuing to be something just within the community? Because, again, that gets to that idea of how much is actually within our community and how much is, passing through, et cetera, to help us to understand, what we should be expecting as far as things coming into healthcare locally. It doesn't involve a whole lot of sophistication, but then when they identify contacts and those types of things, they reach out to those folks and ask them to self-quarantine and to monitor for symptoms and to notify, the health department in the event that they develop symptoms, so that they could potentially be tested and or just given further support on how to continue to keep others safe when they're likely, in fact, with the disease. So not a new concept at all, and it's part of the way that we help to contain transmissible viruses, is by tracing back the source and then future contacts, so that you go, that you can isolate those folks appropriately. So I don't think there's anything dramatically new here. It's just that this is on such a large scale that, there are more people being impacted by it. Now, the question that I have is just, when does it, kind of like the flu, at some point it doesn't become that valuable to do this. So I know obviously right now they're still trying to do a lot of tracing, but at some point, there's just enough of it out there, it becomes impossible to know.
Yeah.
Did you get it because you walked into Walmart, or did you get it to walk into a shop somewhere else, or did you get it at, who knows? And no disrespect to Walmart, they're doing a great job keeping a lot of things very safe there. But as folks get out into the community just to do their daily activities, it really becomes impossible to do formal contact tracing. So I appreciate the incentive around it, but it's getting harder and harder to do.
I just read a new study that was out, and it said something about the virus can enter your body through a person's eyes.
Ugh.
The eyes.
The eyes. I'm staring at you, the eyes. Have you heard that, or?
Well, so the eyes are unique, and I do think this is one of these things that we're going to see change in the way that healthcare operates probably forever. And, the eyes are really a mucous membrane, basically. So the eye's surface is a lot like the surface of the nose or the surface of the lungs or, the intestinal tract and those types of things where they have a very thin surface, obviously, so that you can see through them and those types of things. But then they allow penetration of the virus, and thus all those instructions around don't touch your face, that, yes, is to keep your hands away from your mouth and nose, but it's also to keep them away from your eyes. And, as you, fortunately, hopefully you've not had to come into the hospital, but I'm sure if you do, you realize that everyone's now wearing glasses. They're wearing eye protection in addition to their face mask as part of just routine protection. So if somebody sneezes, the mask protects you from breathing it in or sucking it up your nose, but the eye protection catches that splatter then on the glass because the eye is actually very much the same type of membrane as the nose. And so I think what we will see, and I'm kind of surprised it hasn't happened a long time ago, this has been one of the things that's interested me a little bit, is that I think eye protection will become part of routine protection for healthcare workers taking care of somebody with a respiratory or with an airborne illness. So when something is a cough, sneeze type of illness, we're going to see folks wearing eye protection all the time. And that's new. I mean, that's one of those things that came out around this because of the level of transmissibility, and I think is probably it is an improvement. It's going to keep us all safer.
Right. Yeah. Now you mentioned face masks, and whenever I'm out walking, I don't really wear a mask outside when I'm walking because it's you can keep your social distancing. We've had some stories, and I think. Morning Brian had mentioned this earlier this afternoon about a guy in China basically had a punctured lung because he was running with a face mask on. I mean, do you really need to have a face mask when you're outside walking or running or just exercising like that?
Sure. Now, there's some really good evidence that correlates not only, being exposed, quote unquote, to somebody with COVID-19, but also the length of the exposure. And so, incidental contact in an open air environment, because you pass them on the trek trail, the risk is extremely small. I don't know how you would ever, even if you ended up with it again, it's probably more likely you caught it in a smaller environment. Things like, but inside, things like elevators, where you're in there for a period of time is different, and office space where you actually have direct contact and that 6 foot distance gets broken, carries a higher risk. So it's both, being exposed to someone with the disease, but also the duration of the exposure. Incidental contact to somebody, especially in an environment where it's not likely to, you may have breached social distancing for the whopping, half a second as you pass before you span them 6 feet, is just not realistic. As far as the risk of wearing a face mask, this is something that has had some scrutiny around it as far as people that are unable to because of limited lung capacity, things like that. Because I notice it personally when I throw that mask on. It's a little harder for me to breathe. It is. And so, folks that already have a compromised lung capacity, need to be trying to minimize how much they have to be in that face mask, practicing social distancing, and of course, at this point, still minimizing social activity because of the regulations around requiring face masks. But they're not an entirely benign intervention by any means, and that's why I think we talked a few times about what type of fabric to use. And so, just a cloth made out of cotton type fabric is much easier to breathe through than some of the fleeces and things like that people have made, and they're great, and we're certainly appreciative of it, and we'll still love to have mask donations because this is not going away anytime soon. But the fabric itself does make a difference in how hard it is to breathe through it. And so sticking with a cotton face mask still provides that barrier for spit directed at you, which is what it's all about.
Yes.
But makes it so that you can actually breathe through it more easily.
And Dr. Jennings, one question I've been thinking of for a little while. It's really just a general question, but there's so much information that's come through about the infamous antibody testing. After you've supposedly had the illness and your immune system is recovered and handled it, I guess you could say, or treated it, and you have these things I think called antibodies, and they can test if you've had those to see if you've had the illness in the past. There's so much information that comes through on this. Do you have anything really lately that's come out that might see some future usage around here? I really haven't heard much of it around central Illinois. Any new developments in that area?
I think you actually just described it really well, and that's the idea that, the body's immune response puts out antibodies, whether it's this disease or other diseases, especially viral diseases, that the body creates antibodies, and then those can be measured to see if you've had an infection before and theoretically whether or not you're immune to that infection in the future. Coronavirus has been particularly challenging there because there's a lot of different strains of coronavirus. So kind of like the flu, I could draw antibodies to influenza, and almost everybody that's been around for more than a year, probably has antibodies to flu, but will it be the right strain? And so they're working hard to identify the parts of this virus that then can be identified in the antibody that says, no, that really is COVID-19. Now, the immunity piece hinges upon the idea of, one, the body mounting an adequate response to that. And there are some folks that don't mount adequate responses, those same people that we worry about, those vulnerable populations. Mm-hmm. And then there's also the fact that the virus mutates. So like the flu, you could test and say, hey, you're immune. Good news. You're immune to last year's strain. Yeah. Well, here's this year's strain. Mm-hmm. And so, as this virus does what most viruses do, the value of that, we just don't know yet because we haven't had it out there long enough. The one thing that is going on that I think is interesting is the idea of plasma donation for people that have recovered from the disease. So folks that have known to have the disease, that have proof that they've had it, they've been tested, they know they have it, then they are collecting plasma from those folks, and which is kind of the part of the blood supply that contains the antibodies. You think about the red part, which is the red blood cells that we normally think about. When you separate the blood, there's kind of a layer of clear fluid. Well, that's plasma. Plasma contains those antibodies. And so there's a lot of research going on of using plasma as part of the treatment in people that are severely ill with this. And so some of our area blood banks for folks that have proven that they've had the disease and have fully recovered and now are testing negative can be participating and donating that plasma as a way to help with treatment and will hopefully help with treatment. We don't know. Right. Full plasma has been used, though, in the past for a variety of illnesses and generally speaking seems to be useful. But obviously, there's just so much unknown about this particular disease. But at a minimum, you can always go donate blood, and I know those blood banks appreciate that. And certainly we all hopefully never need it, but when we do, helping to keep the blood supply up is a good thing.
Right on.
All right, Doctor, thanks. We could talk to you for 30 or 40 minutes, honestly, Doc. You do this so well. And like I said at the outset of this, we've had so many people tell us how much they appreciate hearing your words. Obviously, you're a very calming voice, and I don't mean that in your tone, but you do it really well. And you bring a lot of facts and not fear to this. So thanks so much again for joining us today.
It's always my pleasure, and thank you to WXEF for giving us the opportunity.
Always. Doors open.
Good deal.
All right.
Thanks, Doctor. Have a good day.
Thank you.
Bye-bye.
There you go. As always, there's Dr. Ryan Jennings, Chief Medical Officer at HSHS St. Anthony's Memorial Hospital.